Welcome dear students. So now we will start the bacteriology section, and in this we will start first with gram positive bacteria and then we will take the gram negative bacteria. Okay. So in gram positive bacteria, we have two important groups, gram positive cocci and gram positive bacilli. So we will take one by one each group. First we will cover the gram positive cocci and then we will take gram positive bacilli. In cocci we have two important groups. First is the Staphylococcus. So first group is Micrococci family. Including the staph and a normal flora part, that is non-pathogenic Micrococcus, and second is the Streptococci family. Is having our bacteria like Streptococcus, including Streptococcus pneumoniae and Enterococcus. So in gram positive cocci we will be taking two important groups. First is the Staphylococcus and second is the Streptococcus, including the various Streptococci, Streptococcus pneumoniae and Enterococci. Okay, so this we will take. In gram positive bacilli we will take the first we will take bacteria like Corynebacterium. Next is the spore forming aerobic bacteria, that is the Bacillus. Then spore forming anaerobic bacteria, Clostridium. Then a very important group of acid fast bacteria, Mycobacterium. And last is the miscellaneous group, where we will take the Actinomycetes and Listeria. Okay, so first we will be taking the gram positive cocci group and then we will go on to the gram positive bacilli. So as far as gram positive cocci is concerned, I told you that there are two important families. First is gram positive cocci. So there are two important families. First is the Micrococci and Streptococci. Okay, so in Micrococci the important bacteria are, first is we are talking of the pathogenic bacteria. So the first and the most important group is the Staphylococcus. And then Streptococcus group, including various type of Streptococci, Streptococcus pneumoniae and Enterococcus. Okay, so Micrococci, apart from Staphylococcus we have Micrococcus also, which is non-pathogenic. Okay, so we will take one by one and we will start with the Staphylococcus group. So as I told you that in Micrococci the pathogenic bacteria is the Staphylococcus, whereas Micrococcus is non-pathogenic. Okay, so whenever across the examination, be it a direct examination or if we are getting a culture isolate resembling like a Staphylococcus, we have to differentiate it from the pathogenic one, that is Staphylococcus. So how can we do this? Right from the microscopic examination to the culture to confirmation. Okay, in the microscopic examination, Micrococcus can be differentiated from Staphylococcus by some important points. That is, first is the gram-positive cocci arranged in tetrads. They are arranged in a group of 4, whereas Staphylococcus, it is arranged in the group, a bigger group, that is bunch-like or grape-like cluster. So gram-positive cocci in tetrads. And next is these gram-positive cocci which are arranged in tetrads. They are oxidase, modified oxidase positive, showing a oxidative mechanism. So this can also be demonstrated by a OF test. Then these are furazolidine, resistant. Okay, so these are the important points for the Micrococcus to differentiate it from Staphylococcus. So only these 4 points we should keep in mind to differentiate Staphylococcus and Micrococcus, which is a non-pathogenic bacteria resembling like a Staphylococcus. Okay, so with this we will start with our main bacteria, that is Staphylococcus. Okay, so as I told you that whenever we talk of Staphylococcus, the important of this group is, as the name itself implies, coccus means the cocci or round shaped bacteria and staphylo means bunch of grapes. So these are classical gram positive cocci arranged in clusters. Okay, and the important bacteria are Staphylococcus aureus and other bacteria, and these two we differentiate by an important test, that is a catalase test and a coagulase. Okay, so in the last class we have also talked about this, that whenever we come across a gram positive cocci, we have to start with 2 important biochemical tests. First is the coagulase catalase test and the second is the catalase test. So now we know, because we have completed the biochemical test for identification of bacteria. So catalase, it is used to differentiate between the Staphylococcus and Streptococcus. Okay, so any gram positive cocci, if it is catalase positive, it means it is Staphylococcus. Because Streptococcus is catalase negative and Staphylococcus is catalase positive. Okay, so when it comes catalase positive means going to the group Staphylococcus, and it may also be Micrococcus, which we have to differentiate on the basis of gram stain and other biochemical test. Okay, so as far as pathogenic bacteria are concerned, catalase positive Staphylococcus, and in Staphylococcus I told you that the next important second biochemical test for gram positive cocci, it is a coagulase test. Okay, so be it a tube coagulase or slide coagulase test, if it is positive, then it is Staphylococcus aureus. If it is negative, Then the whole group we label it as coagulase negative staphylococci or cons. Okay. So on the basis of coagulase test, we differentiate it into the Staphylococcus aureus, which is coagulase positive, main pathogenic bacteria, and a group of pathogenic and non-pathogenic, because usually these group bacteria are non-pathogenic, but they may be pathogenic, and especially some bacteria they are pathogenic. Okay, because they are associated with certain infections, especially when they are present in certain special conditions or over the time in chronic hospitalization patients with some indwelling devices. This group may be associated with the infections. Okay, so the whole group is placed under the coagulase negative staphylococci, and the important bacteria in this group is Staphylococcus epidermidis, and it is usually present over our skin as a part of normal flora, but it can also cause infections if there are conditions. Okay, or other bacteria is Staphylococcus saprophyticus. Okay, so all these bacteria we will see one by one, and Staphylococcus hemolyticus and other bacteria. Okay, so we will start with the main pathogenic one, that is Staphylococcus aureus. Okay, so apart from all, what we know is it is a gram positive cocci, okay, which is non-motile, and capsule is seen in the young isolates, very thin or micro capsule in the fresh isolates. Okay, so as far as the organism is concerned, it grows on ordinary media. So it grows on all the ordinary media what we use in lab, right from the nutrient agar to blood agar. Okay, and in the last class we have revised that on nutrient agar, Staphylococcus aureus produces a classical golden yellow pigmented colonies. So golden yellow pigment, and on blood agar the colonies are beta hemolytic or showing complete hemolysis around the colonies. Apart from this, it also shows other test positive, like it produces various type of enzymes like phosphatase, heat stable DNases, and thermonucleases. Then it shows positive test for MR test, BP test, and telluride reduction. And positive for gelatin liquefaction. Another important property for this is it is typically positive for fermentation of mannitol, or it gives mannitol fermentation. This property is also incorporated to identify it in the culture media. So these are the important points regarding the organism as far as virulence factors are concerned. So there are certain important virulence factors. So we will start with the organism. First we will start with the cell associated factors or the cell wall associated factors. So as we all know that it starts with the main component of the gram positive cell wall, that is the peptidoglycan. Then another important is echoic acid, which is classically seen only in gram positive bacteria. Next is protein A. Okay, so this is very important to note here that this protein A, it is also, because it is present over the bacteria and it has the receptor to bind with the Fc component of the antibodies or immunoglobulins. So it is used in the serological test because this protein A, it has receptors which binds the Fc portion of immunoglobulin. So it is used for binding the specific antibodies and then it can be used for clumping of the particular organism. Okay, then we have the clumping factor, which is also known as, or which is responsible for the giving the slide coagulase, which is the bound coagulase. Okay, so these are important cell associated factors, right from the general gram positive factors like presence of peptidoglycan, echoic acid, then specific to the staphylococcus, that is protein A, then clumping factor, and the other factors like the capsule or microcapsule, because it is very thin, especially in the freshly isolated strains. Okay, next is, apart from the cell associated factors, second important group is the presence of various type of toxins which makes staphylococcus very pathogenic. Okay, so what are these toxins? So first is, it is hemolysins. These are of various types like alpha, beta, gamma and delta. Now, because a lot of questions are being asked, so we should know all this. Alpha, it is also known as a paradoxical toxin for paradoxical reactivation because it exhibits hot cold phenomenon. All these are asked in MCQ, so it is important to note here that at 70 degrees centigrade it becomes inactive. Again on high temperature it becomes activated, so showing hot cold phenomenon. Beta is a sphingomyelinase. Which is toxic for the red cells, and gamma, it is made up of two parts. Two components, and both are required together for their toxicity. Okay, so it is a bi-component toxin, and delta is having a detergent like action. So apart from hemolysis, it is hemolysins, it is also producing certain other toxins like leukocidins. And the most important leukocidins, as the name itself is implying that it is doing, or it is responsible for the lysis of various phagocytic cells like the neutrophils and macrophages. The classical example is the penton valentine leukocidin. and it is also a two component toxin which is made up of two parts, F for fast acting and S for slow acting toxin. Next is the various other toxins, and the most important is the exfoliative toxin, which is responsible for the classical virulence of the Staphylococcus, producing the exfoliative lesions of the skin like the Ritter's disease, which is a disease of newborn, a severe exfoliating disease of newborn. 10, which is also a severe disease, it involves the elder persons, and other mild diseases like pemphigus neonatorum. So all these are responsible, these conditions are exfoliating conditions, and these are mainly because of the toxin, that is the exfoliative toxin. Okay, so apart from exfoliative toxins, we have other toxins also like the enterotoxin. Okay, and as it produces the enterotoxin, as the name itself is implying, it is associated with the gut disease, so it is causing food poisoning, responsible for food poisoning, and it classically activates the or causes the vagal stimulation, acting on the enteric nervous system, so it leads to vagal stimulation and activation of vomiting center. Okay, and the next is the toxic shock syndrome toxin, very important for the Staphylococcus pathogenicity. Toxic shock syndrome toxin, which is associated with a huge amount of inflammation, as the name itself is implying that it is a very strong type of antigen, because this acts as a super antigen. Okay, and it causes massive stimulation of a large number of T lymphocytes, and there is a production of huge amount of cytokines, large cytokines, and which is associated with huge inflammation and systemic manifestation. So it is classically known as toxic shock syndrome. Okay, so now when we are talking of toxins, it is very important to know two important points here. Two toxins are very important, that is two toxins of staph are made up of two components, that is bicomponent toxin. They are known as bicomponent, or because these synergistic activity of these two toxins is required for their action, so they are known as synergohymenotrophic toxins. And it is very frequently asked question in as far as staph is concerned. So synergohymenotrophic toxins, which are made up of two components. So because we have finished now the toxin part, so what are these two toxins which are synergohymenotrophic for Staphylococcus aureus? So this we have seen that first is the gamma hemolysin, and the next one is the PVL or Panton Valentine leukocidin. Okay, And the third is the liberation of a variety or various types of enzymes. So the third important category of virulence factor is the various enzymes which the Staphylococcus secretes, like the phosphatases. These all are associated with the cell destruction and invasiveness, like phosphatases, lipases, hyaluronidase, staphylokinase, DNases, and heat stable thermonucleases. So all these are important virulence factors as far as Staphylococcus aureus is concerned. And coming to the important infections or diseases associated. Okay, so it can cause a range of diseases or infections, starting from the mild skin infections to the severe systemic involvement in the form of toxic shock syndrome or various systemic infections like the bloodborne infections, septicemia, meningitis, pneumonia. So it can cause various type of infections like the skin and soft tissue infections, that is we called as SSIs, that is from the small infection of the skin like a boil or furuncle or carbuncle, impetigo, and important point to note here is both Staphylococcus and Streptococcus, they are commonly involved in the causation of impetigo, but Staphylococcus is involved more with bullous type of impetigo. So bullous impetigo. Similarly, the classical organism for the deeper infections, that is necrotizing fasciitis. It is mainly caused by the more invasive organism, that is Streptococcus, especially the group A Streptococci, but it is also caused by Staphylococcus. Okay, and then wound infections. Surgical site infections. Including the wound infection or stitch abscess. So various type of abscess. Next is the invasive lesions like pneumonia, meningitis, and apart from pneumonia in the respiratory, it is classically associated with the nematoceles, which are air-filled cavities. Nematoceles and various other type of respiratory infections. Meningitis, bacteremia, urinary tract infection, septicemia. Then the toxin mediated illness, that is toxic shock syndrome, and the exfoliative toxin mediated illness resulting in the skin with various type of infections. So exfoliative toxin mediated. That I told you that in the newborns or the younger, it causes the Ritter's disease. In elderly, 10, or toxic epidermal necrolysis. then pemphigus vulgaris. Okay, so all these infections or bullous pemphigoid, all these are seen in the because of exfoliative toxin, other toxin mediated illness like because of enterotoxin causes food poisoning. Now, another important point to note here is when we talk of food poisoning, the staphylococcal food poisoning is a classical food poisoning where the incubation period is very short, that is, it is less than 6 hours. Okay. Then the infections in the other invasive infections like endocarditis, especially which are associated with the native walls. So native wall endocarditis or shunt infections. Okay. So all these are caused by Staphylococcus aureus. So these are classically seen in the infections with Staphylococcus aureus. Okay. So as far as these infections are concerned, next is we will see the various methods to diagnose the infections caused by Staphylococcus. So coming to the lab diagnosis, which starts with the procurement or obtaining of the relevant specimens. Then we will see the direct examination from the specimen, which will classically reveal the inflammatory cells like the polymorphonuclear cells. Depending on the specimen, if it is a Pusk specimen, it will reveal more number of the polymorphonuclear cells along with the gram-positive cocci in clusters. Then we can go for isolation. So culture, so as I told you that Staphylococcus aureus, it is classically it grows on the ordinary media like nutrient agar where we see the golden yellow pigment. Or we can use other media to show its various properties like the beta hemolytic property. So we can grow it on blood agar showing the beta hemolytic colonies. Then the other selective media which are used for growing it as a selective agent, and also they helps to identify out of the other commensals. Okay, so the classical example is mannitol salt agar. Showing the yellow colored fermenting because of the mannitol fermentation, this shows the yellow colored colonies. Or salt milk agar or Ludlum's medium. All these are having high concentration of salt because it withstand a high concentration of salt also. And as far as confirmation is concerned, because after from the culture gram staining we can make a presumptive diagnosis and it can be confirmed with the biochemical identification. So for biochemical identification, it is done by the biochemicals. As far as gram positive cocci is concerned, two important biochemicals. First is catalase test, which will be positive here because it differentiates between Staphylococcus and Streptococcus. So catalase will be positive for Staphylococcus. Next, for Staphylococcus aureus, the second important biochemical for gram positive cocci will be positive, that is coagulase test. And in the last class where we read or talk about the bacterial identification, we saw that there are two important methods for coagulase test. First is the slide coagulase test. and another is the tube coagulase test. Okay, and these two are totally different type of test. If any isolate it is coming, because slide is very easy to do, immediately we will emulsify the colony in saline, and if we add a few drops of plasma, we will see the clumping. If it comes negative with this slide, we have to confirm it with putting a tube coagulase test, which takes few hours to become positive. Okay, and what happens in slide coagulase test, as I told you that it is having a bound factor or clumping factor with it, which is also known as, because of bound coagulase, this is known as bound coagulase or clumping factor. Okay, so with this many cells are joined together and ultimately it results in formation of a clump. Whereas what happens in tube coagulase test, here the tube coagulase, this is in this the coagulase, it is actively secreted outside. So this is an enzyme which is secreted outside and it reacts with a factor present in the plasma, that is known as coagulase reacting factor. Okay, and here it reacts with coagulase reacting factor and ultimately it results in the formation of a clot, because coagulase enzyme ultimately with the fibrin it makes a clot. So ultimately it forms a coagulum made up of fibrin and the various cells. So it results in formation of a coagulum because of the tube coagulase or free coagulase. Okay, so free coagulase plus coagulase reacting factor, it leads to the formation of a coagulum with the fibrin and the organism, ultimately resulting into the formation of a coagulum. So these are the basic differences between the slide coagulase test or bound coagulase and because of a free coagulase which mediates the tube coagulase test, where the CRF is important, that is the coagulase reacting factor. Okay, so with this we can confirm the organism as Staphylococcus aureus. And when we are talking of coagulase test, few points are important because these are asked in various exams. So we should know here that the important organisms which are coagulase positive are species of Staphylococcus, they are Staphylococcus, Staph aureus and Staph filiferi, Staph lugdunensis. Okay, these species are very important because Staphylococcus, Staph aureus, these are classical example of both tube and slide coagulase test, whereas filiferi, S for S, it is positive for the slide coagulase test. Sorry, filiferi, it is positive for tube coagulase. And lugdunensis positive for slide coagulase. Okay, so these are important points which are asked frequently. So it is important to know these coagulase examples of bound and free coagulase test. Then for confirmation with biochemicals, apart from coagulase test, the next important biochemical is mannitol fermentation. So this can be detected either by growing the organism, which is where the mannitol is incorporated into the media itself in the form of mannitol salt agar or salt milk agar, or we can detect the sugar fermentation test where the sugar is mannitol. Okay, so next confirmation is the mannitol fermentation test or other specific test for detection of DNases or thermostable nucleases. Okay, so all these are important tests for confirmation of the Staphylococcus, and else we can confirm, because nowadays it is important to know, we are interested to know not only about Staphylococcus aureus, we are interested to know about the molecular level, because nowadays problem is not Staphylococcus aureus only. Nowadays problem is the resistant variant, that is the methicillin resistant Staphylococcus aureus. So we can go on detection for further detection for the presence of the product, that is the either the penicillin binding protein product, or we can detect the molecular gene which is responsible, that is the MEK gene, by various molecular tests in the for the identification of Staphylococcus for further identification. Okay, so they can be identified by molecular test for detection of either the proteins or the gene, that is the MEK gene. Okay, so all these are used for identification of Staphylococcus aureus. As far as treatment is concerned, if it is a sensitive strain, then we have to use the penicillin or ampicillin. If it is a penicillin resistant strain, okay, so penicillin resistant strain, these are mainly because of the presence of beta lactamase enzyme. So penicillin resistant strains, these are mainly because of due to beta lactamase production. So here we can give the inhibitor combination of the beta lactamase, okay, like amoxiclav. That is the amoxicillin and clavulanic acid. Okay. Next is the MRSA, that is methicillin or beta lactamase resistant penicillin. So this is methicillin resistant staphylococci. Okay, so here we are giving either the combination in the penicillin resistant strain, we were using the amoxiclav, the combination with the inhibitor also, but in methicillin resistant Staphylococcus aureus, here we cannot use the beta lactam agents and their inhibitor combinations also, because it is a gene coded, that is a MEK gene coded resistance, which is altering the binding site. So when the binding site is altered, whatever drug is coming to bind here will not effectively act against the organism. Okay, so for these organisms, the inhibitor combination or the beta lactam drugs will not be effective. So here we have to use the higher drugs like vancomycin, or we can use linezolid or daptomycin, or clindamycin, or we can use the fixed dose combinations of streptogramins and delphocristin. So streptogramins, which are fixed dose combination of the delphocristin and quinapristin. So all these we can use, and we can also use the newer generation cephalosporins like ceftobiprole. Okay, so all these we can use for the organism which are showing the which are showing resistance against methicillin or oxacillin. Okay, so for detecting this methicillin resistance, we are using the drugs like, because methicillin, it is a unstable compound. So while performing the antibiotic susceptibility testing to detect the methicillin resistant organism, instead of methicillin we are using oxacillin, because it is stable as compared to methicillin, or the better drug is cefoxitin, which is mostly used nowadays because it is used as a surrogate marker for methicillin resistance. Okay, so by while performing the antibiotic susceptibility testing, we have to put the cefoxitin disc. If it is resistance, it shows that no beta lactam drugs or inhibitor combinations or penicillins, they will be active against this isolate, and we have to opt for higher drugs like linezolid, vancomycin, daptomycin, or other drugs for treatment of such type of infections. Okay, so as far as Staphylococcus aureus is concerned, it is a very important, very common organism which is seen associated with the common infections, and also it is a very important organism as far as hospital acquired infections are also concerned. Okay, so as we all know that Staphylococcus aureus, it is also present in our body also, and many persons are acting as a carrier. Okay, so up to 30% people are acting as a carrier for Staphylococcus aureus, and the most common sites are, most common is the anterior nair, and the other sites are the skin of the folds like axilla, perineum. Okay, so at all these sites it is present as commensal, and the people will be acting as carrier. They may transmit the infection from one place to other place, or from one person to other person. So it is very important to know this point in mind, that many people, especially this is talked in context of the hospital acquired infections and hospital workers, hospital staff, because they may be having it in their hands, and with the hands, which is the most important mode for transmission of the organism from one place to other, or from one patient to other patient, that is cross infection. Okay, so it is important to know that it is present, it may be present in the nasal cavities of the healthcare providers or healthcare workers. Okay, so as far as resistance in Staphylococcus aureus is concerned, the important types of resistant in case of Staphylococcus. So the two broad category resistance mainly we see. First is the resistance to the beta lactam drugs like penicillin and cephalosporins, and resistance to the cell wall acting drugs, glycopeptides like vancomycin or teicoplanin. Okay, please note, vancomycin resistance is very rare as far as Staphylococcus aureus is concerned. It is seen more in other organisms like Enterococcus, but not in Staphylococcus aureus. Though we are having resistant strains, but it is not at all common to see the vancomycin resistant Staphylococcus aureus strains. Okay, so first we will see the resistance to the beta lactam drugs. So as I told you that first it may be because of the production of a beta lactamase, that is penicillinase production. Is a classical example of beta lactamase, which break the beta lactam ring, and it makes the drug ineffective. Okay, so this type of penicillinase production, when we see this type, then we can see if it is present. It can be detected while performing the antimicrobial susceptibility testing. And here we see that around the penicillin or ampicillin there is a zone which is small in size and it is thick at the periphery or heaped up margins. Okay, so it is mainly because of penicillin production or penicillinase production. Next is the change of or alteration of the binding site. Okay, that is the change to the formation of penicillin binding proteins 2A, which is coded by MECA gene, which is a part of chromosomal mobile elements. Okay, so it ultimately codes for a different kind of binding protein which are having low affinity for binding of the beta lactam drugs. So in the first option, as we have already seen here, we can use the beta lactam drugs with their inhibitor combinations. But if it is because of the penicillin binding protein 2A, it will not bind and even the combinations will also not work. And here we have to use the higher drugs like vancomycin, linezolid and other drugs. Or the resistance, it may also be acquired because of the prolonged use due to development of tolerance. Okay, so these are all important mechanisms for the beta lactam resistance. And as far as the vancomycin resistance is concerned, it is mainly mediated by VAN-A gene. Okay, so it is chromosomally mediated and it is mediated by VAN-A gene, and the strains which are resistant to the vancomycin, they are known as vancomycin resistant Staphylococcus aureus or VRSA. Okay, and here the MIC for vancomycin is very high, more than 16 microgram per ml, and these strains are known as VRSA. These are because of the gene VAN-A gene. Okay, and there is another category that is known as vancomycin intermediate Staphylococcus aureus or VISA. Okay, so please note that in this category the MIC is around 4 to 8 microgram and it is not VAN-A mediated resistance. It is a resistance which is seen. Suppose this is an organism. When it grows in chronic presence of vancomycin, the cell wall thickness is increased drastically. Okay, so this will not allow the antibiotic to penetrate. Okay, so it is the main underlying mechanism is the cell wall thickening. Okay, so again this is a very important question, area from where the question can be asked, and it is asked nowadays. VISA, the underlying mechanism, it is not the VAN-A gene, it is the cell wall thickening. Okay, so it occurs because of cell wall thickening. Okay, not VAN-A mediated strains. So as far as vancomycin resistance is concerned, two important varieties: vancomycin resistant variety VRSA, VAN-A mediated, and vancomycin intermediate Staph aureus, where the MIC is raised but it is not VAN-A mediated. It is mainly because of cell wall thickening. Okay, similarly there is another term when we talk of the beta lactam resistance. So it is because we are talking about the resistance mechanisms in the Staphylococcus, and it is a very notorious organism with all mechanisms of all type of resistance, and with all days passing by we are seeing new and new mechanism for development of resistance in Staphylococcus aureus. So as far as beta lactam drugs resistance is concerned, we should know now the another latest term, that is the BORSA. So what is this BORSA? This is borderline oxacillin resistant Staphylococcus aureus, and again it is showing the raised MIC or high MIC for oxacillin or methicillin, and it is mainly because of the hyperproduction of beta lactamase. So here the mechanism is hyperproduction of beta lactamases. Okay, so as far as resistance in Staphylococcus aureus is concerned, please remember these important points, because this is a very important area where nowadays more and more questions are being framed. Okay, so this finishes the important part regarding the Staphylococcus aureus. Next we will start with the next bacteria, that is Streptococcus. Before going into the Streptococcus, so after Staphylococcus aureus, we should know two important other Staphylococcus species. First is Staphylococcus epidermidis. As I told you that it is a normal flora of our skin. So this is also the most common bacteria belonging to the cons group or coagulase negative staphylococci. So Staph epidermidis, it is most common cons. It is having a microcapsule, or it is very notorious for production of biofilms. Okay, so whenever there is a artificial or prosthetic device, it is associated with infection in all these, in the prosthetic device or in the indwelling catheters, because of the formation of biofilms. So it makes a slime around the bacterial colonies where the drug is not able to penetrate, and this way it causes infection also, and which is not accessible for treatment also. Okay, so it is responsible for various type of abscess infection, stitch abscess infection. So it is responsible for causing various infections like classical for stitch abscess or ventricular shunt infections. And also in the IV lines, when they are lines for prolonged duration, so it may be responsible for causing the bacteremia. Okay, so all these are important as far as Staphylococcus epidermidis is concerned. The second important species of the cons group or coagulase negative staphylococci is the Staphylococcus saprophyticus. Okay, so few important points regarding this. It is novobiocin resistant, and it is very important cause of UTI. Especially in young females, it is a most common cause of UTI for causing UTI in young sexually active females. UTI in young sexually acting Okay, so please remember Staphylococcus saprophyticus as an important agent of urinary tract infection as far as young females are concerned. Okay, so this finishes the Staphylococcus topic. Next we will be starting with the Streptococcus.